Coming to the second class, that is fibric acid derivatives. This is the general structure for fibric acid derivatives. These are some of the examples of the compounds belonging to the class of fibric acid derivatives. Here in the general structure we can see there are mainly two substitutions, that is at R1 and R2. The different substitutions at R1 and R2 results in the different compounds of this particular series. The examples of the drugs belonging to this class include clofibrate, famofibrate, ciprofibrate and benzfibrate. One more drug also is there, that is gemfibrozil. Coming to the mechanism of action of fibric acid derivatives. They activate alpha peroxidase activated receptors. This enhances the synthesis of lipoprotein lipase. Then there is an increase in the degradation of VLDL. This also enhances the fatty acid oxidation. Coming to the SAR of fibric acid derivatives. These fibric acid derivatives are also known as fibrates. Isobutyric acid group is essential for the activity purpose. Compounds containing an ester such as clofibrate and fenofibrate are prodrugs and require in vivo hydrolysis. Substitution at the para position of the aromatic ring with a chloro group or a chlorine containing isopropyl ring produce compound with significantly longer half-life. Most of drugs contain a phenoxyisobutyric acid. The addition of an M-propyl spacer as seen in gemfibrozil results in an active drug. Coming to the third class, that is bile acid sequestrants. These are the examples of the drugs belonging to the class of bile acid sequestrants. This is the structure for cholesteramine. This is the structure for Verifex, and this is a structure for cholestyramine. Coming to the mechanism of action of bile acid sequestrants. They bind with bile acids, interfere in the hepatic oxidation and results in excretion of cholesterol. This also results in the enhancement of hepatic metabolism of cholesterol to bile acids. Thus, more LDL receptors are exposed on liver cells. This results in the increased clearance of intermediate lipoprotein and VLDL. Coming to the SAR of bile acid sequestrants. This SAR we will be studying with reference to the two main drugs belonging to this class, that is cholesteramine and cholesterol. Cholestyramine is a copolymer consisting primarily of polystyrene with small amount of divinyl benzene as a cross-linking agent. In addition, it contains some fixed quaternary ammonium groups. These positively charged groups functions as binding sites for anions. Cholesterol is a copolymer of tetraethylene pentamine and epichlorohydrin. It contains basic secondary and tertiary amines. Total nitrogen content of cholesterol is greater than cholestyramine. The functional ion exchange capacity of the resin depends upon intestinal pH and may be less than cholestyramine. The adsorption capacity of cholestyramine for bile salts is more than the cholesterol. This is the structure of cholestyramine and this is the structure for cholesterol. Coming to the fourth class, that is LDL oxidation inhibitors. Example includes probucol. This is the structure for probucol. And the fifth class is pyridine derivative. Example is nicotinic acid. This is the structure for nicotinic acid. Coming to the mechanism of action of pyridine derivatives. Nicotinic acid inhibits the lipolysis of triglycerides by hormone sensitive lipase. This reduces hepatic triglyceride synthesis. This in turn reduces transport of free fatty acids to liver. This results in the decreased production of hepatic VLDL. Fifth class, miscellaneous. Example includes beta-cytosterol. This is a structure for beta-cytosterol. Its UPAC name is 3-beta stigmast 5N3-ol. And one more example is dextrothyroxine. This is a structure for dextrothyroxine and the UPAC name for the same is O4-hydroxy 3,5-diiodophenyl 3,5-diiodo-tyrosine. Coming to the synthesis. So in the synthesis part, we are studying the synthesis of clofibrate. So this is the simple synthesis of clofibrate, which involves basically the three important starting materials, that is 4-chlorophenol, acetone and chloroform. So when these three starting reactants are subjected for the reaction, that is for the refluxing purpose, in the presence of sodium hydroxide, they result in the formation of clofibric acid, which on further treatment with ethanol, there will be a liberation of hydrochloric acid and there is a formation of final compound of our interest, that is clofibrate. After the end of the discussion on the anti-hyperlipidemic agents, there are some frequently asked questions which we need to know. Some of them are listed here. First one, what are anti-hyperlipidemic agents? Give one example for LDL oxidation inhibitor. Second one, classify anti-hyperlipidemics with examples. Third, write the mechanism of action of HMG-CoA reductase inhibitors as anti-hyperlipidemic agents. Fourth, write the mechanism of action of bile acid sequestrants as anti-hyperlipidemic agents. Fifth, write the mechanism of action of fibric acid derivatives as anti-hyperlipidemic agents. Sixth one, give the synthesis of clofibrate. Thank you.